I'll be using the various specimens to demonstrate the brachial plexus. I will then follow the 5 main nerves, pointing out their distribution. Before showing the specimens, I want to make 5 points regarding the plexuses and the muscle innervation. 1. The cervical, brachial, lumbar and sacral plexuses are formed by the ventral rami of spinal nerves. They are named according to the region where they are located. 2. Generally, the nerves derived from the anterior divisions are meant for the flexors, while the posterior divisions are meant for the extensors. Third, it is a divine rule that the nerves that pierces a muscle must supply it. Fourth, a nerve that supplies the muscle must also supply the joint that the muscle acts upon. Fifth, the nerve supply to an organ or a part remains constant. It is related to its embryological development. For example, the diaphragm is supplied by the phrenic nerves derived from the cervical segments of the spinal cord as it develops in the neck. The brachial plexus starts in the neck, enters the axilla and innervates the upper limb. It is formed by the ventral rami of C5 to 8 and T1 nerves. It is anatomically divided into 5 parts: roots, trunks, divisions, cords and branches. Robert Taylor drinks coffee black may help you to remember the parts and the order. Let us now look at the specimens. We are looking at the neck. Roots and trunks are located here. For orientation, this is the clavicle. Here is the internal jugular vein. This is the scalenus medius and this is the scalenus anterior, the 2 scalene muscles. Coming between these 2 muscles are the roots of the brachial plexus, which are formed by C5, 6, 7, 8 and T1 ventral rami. The roots join to form trunks. C5 and 6 join to form the upper trunk. C7 continues alone as the middle trunk, which is right here, and C8 and T1 join to form the lower trunk. Each of the trunks divides into divisions, anterior and posterior, which are located behind the clavicle and then enter the axilla. The divisions join to form cords, and the cords are named according to their relationship to the second part of the axillary artery. This, by the way, is the axillary artery, and here is the cut edge of the axillary vein. This muscle that you're seeing that I reflected, that is the pectoralis minor, the part of the axillary artery which lies deep to or beneath the pectoralis minor is called the second part. So the anterior division of the upper and the middle trunk join to form this, which is the lateral cord. The only anterior division left is that of the lower trunk, and that continues alone as the medial cord. The 3 posterior divisions join together to form the posterior cord, and you can't see the posterior cord in this specimen because it is hidden behind the axillary artery. Let us now move on to see some of the branches from these cords. The lateral cord has 3 branches. This one here is called the musculocutaneous, so called as it supplies the muscles in the anterior compartment of the arm and skin in the forearm. The next branch here on the pointer and that I am holding now is the lateral root of the median nerve. It joins with this something else to form the median nerve, and because this part is coming from the lateral cord, hence its name. The third branch is the lateral pectoral nerve, which supplies the pectoralis major. The medial cord has 5 branches. This one here, which joins with this other bit coming from the lateral cord, is the medial root of the median nerve. The next one here, this large branch coming down to go to the forearm, is the ulnar nerve. This thin one goes to supply the skin on the medial side of the forearm, and hence its name, medial cutaneous nerve of the forearm. There is another smaller nerve, and sometimes the two come together, which goes to supply the skin of the arm and coming from the medial cord, so is called the medial cutaneous nerve of the arm. The last one is the medial pectoral nerve, which supplies both the pectoral muscles. So the medial pectoral comes off the medial cord and the lateral pectoral nerve comes from the lateral cord. The posterior cord also has 5 branches, though only 3 of them can be seen in this specimen. I am holding the other branches from the other 2 cords in my left hand, and this here is the axillary artery. This first branch that I am pointing to now is the axillary nerve. It's in the axilla and it's going behind the neck of the humerus to go and supply the deltoid. As I move these to one side and the artery, you can perhaps appreciate this big nerve that you are seeing here is the radial nerve, and it's going to go around the humerus, around the in the spiral groove, and we'll follow it later. The third branch from the posterior cord here is this one, and that is the thoracodorsal nerve. You can see it going on to supply the latissimus dorsi. The other 2 branches can be seen quite nicely in the shoulder specimen. We are looking at the costal surface of the scapula. This is the subscapularis. Here is the teres major. That is the tip of the coracoid process, and these are the cords of the brachial plexus and their branches. This and this, these 2 nerves coming from the posterior cord are the upper and lower subscapular nerves, which supply the subscapularis. In addition, the lower subscapular nerve also supplies the teres major. Generally, coming between these 2 subscapular nerves coming from here and its cut is the thoracodorsal nerve. This big nerve coming from the posterior cord coming down like this is the radial nerve, and as I move all those to one side, you can see that this is the axillary nerve. There are 2 other nerves that I would like to show. One comes directly from the upper trunk and is called the suprascapular nerve. It goes to supply the supraspinatus and the infraspinatus. The other comes from the roots, 5, 6 and 7, comes deep to these structures, lies on the lateral thoracic wall on the serratus anterior. It is the long thoracic nerve, and it sends a branch to each of the digitations of the serratus anterior. This nerve may be damaged during surgery. Next, I would describe the course and distribution of the 5 main branches. The musculocutaneous nerve comes from the lateral cord, pierces the coracobrachialis and short head of biceps, supplies them, and then it lies between the biceps and the brachialis, supplies both those muscles, and then comes out at the cubital fossa between these two, quite superficial, and it goes on to supply the skin on the lateral part of the forearm, and hence it is also called the lateral cutaneous nerve of the forearm. The ulnar nerve comes down the arm without giving any branches. It goes behind the medial epicondyle, and then it pierces the flexor carpi ulnaris. At this point in the forearm, it's lying between the flexor carpi ulnaris and the flexor digitorum profundus. It supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus, and then comes down the forearm. In the distal third of the forearm, it gives a branch called the dorsal cutaneous branch, which goes towards the dorsum of the hand and can be seen in another specimen. You can also note that in the forearm, the nerve is accompanied by this artery, which is the ulnar artery. The two, the nerve and the artery, cross into the hand by going superficial to the flexor retinaculum. In the hand, the ulnar nerve divides into 2 branches, a superficial branch which then divides into 2, and it supplies the skin on this part of the palm of the hand, and these 2 digital nerves supply these 1.5 fingers the skin, and also turn over to supply the nail beds on the dorsal side. The deep branch of the ulnar nerve pierces these muscles of the hypothenar eminence, supplies them, and actually it supplies 15 of the 20 small muscles in the hand. It supplies all the muscles not supplied by the median nerve. Can you name them? I will now describe the median nerve. These are the 2 roots of the median nerve. Here is the median nerve coming down the arm. It gives no branches in the arm, and then it reaches the elbow. At this point, as you can see, the nerve lies medial to this brachial artery, and this is the tendon of the biceps. Remembering the word tan gives you the order of these structures at the elbow, the median nerve being the medial most. At this point, you can see the median nerve give a branch to pronator teres and also to flexor carpi radialis. In fact, in the forearm, this median nerve is going to give branches to all the muscles that were not supplied by the ulnar nerve. Also at this point, you can see that it's giving this branch which is going deeper, and this branch which is going deeper lies on the interosseous membrane and is hence called the anterior interosseous nerve. It is this nerve which will give branches to the radial half or the lateral half of flexor digitorum profundus, the flexor pollicis longus, and the pronator quadratus. Note that the flexor retinaculum has been cut. Here is the median nerve, and these tendons tied together are those of flexor digitorum profundus. Just before the median nerve goes deep to the flexor retinaculum, in the distal part of the forearm, it gives this tiny branch which goes superficial to the flexor retinaculum, and this branch is the palmar cutaneous branch of the median nerve. It supplies the skin of the palm on the lateral side. After having gone through the carpal tunnel beneath the flexor retinaculum, the median nerve here gives a branch that goes backwards, hence it is called the recurrent branch, and that branch supplies the three muscles of the thenar eminence, the opponents being the most important. It also gives branches, not that but the median nerve itself, to supply these two lumbricals, the radial two lumbricals, as you can see them coming from the tendon of the flexor digitorum profundus. Then this median nerve gives these other branches which supply the skin of the fingers, the radial or the lateral 1, 2, 3.5 fingers, and the nail beds on the dorsal side. We will now follow the axillary nerve. Here it is coming from the posterior cord going around the humeral neck. I will rotate the specimen to follow the nerve on the posterior side. By the way, what is the root value of the axillary nerve? If you said C5, 6, then that is correct. So here is the axillary nerve. It is accompanied by the posterior circumflex humeral artery. This is the deltoid. Part of it has been removed from its origin over there. The axillary nerve supplies the deltoid and also supplies this muscle which is teres minor. In addition, it sends a branch that comes out to supply the skin on the lateral part of the arm, also called the badge area. That brings us to the radial nerve. As I elevate the axillary artery, you can see the radial nerve over here, and then it's going into the spiral groove. But just note, just before it goes, it's giving these two very thin branches, and if you can't see them on camera, you can appreciate them when you are looking at the specimen. These are the branches to two of the heads of the triceps. It's quite characteristic of the radial nerve to give its branches a lot proximal to the muscles it has to innervate, because as the nerve goes in the spiral groove, it lies between the heads of the triceps, and that's when it supplies the two heads again. And then it's coming out here giving two branches. This one that you see coming down is going to continue all the way down the posterior aspect of the forearm as the posterior cutaneous nerve of the forearm. It also gives a branch here that supplies the part of the arm, and that's the posterior cutaneous nerve of the arm, as well as lower lateral cutaneous nerve of the arm. The radial nerve itself then comes out here between these brachialis and brachioradialis and will follow its branches into the forearm. At the elbow, the radial nerve gives branches to the brachioradialis, extensor carpi radialis longus and brevis, and divides into two branches, a deep branch and this superficial branch. The deep branch that you can see here piercing this muscle, the supinator, and will come to the posterior aspect of the forearm where it's going to supply all the muscles. The superficial branch here is accompanied by the radial artery further down the forearm, and then as the nerve comes up here, you can see it divides into numerous branches to supply the skin on the lateral part of the dorsum of the hand and the lateral 1, 2, 3.5 digits except the nail beds. Remember, the nail beds of these 3.5 digits are done by the branches from the median nerve. As the deep branch pierces the supinator and comes to the posterior forearm, it lies close to or on the interosseous membrane, and some people call it the posterior interosseous branch of the radial nerve. It is here that it's going to supply these abductor pollicis longus, the extensor pollicis brevis, the extensor pollicis longus, extensor indicis, extensor digitorum. Here's a question for you. You see these small branches from the superficial branch of the radial, and you're seeing this muscle here. Do you think these branches supply this muscle? The answer is no, they do not, because they are just to supply the skin in this region. This muscle, as you recognize probably, is the first dorsal interosseous supplied by a branch of the ulnar nerve. It is time to review some of the structures that we have seen using the left upper limb from body 3. This here is the clavicle, and this piece of plastic that you are seeing is the one on which I have tied all these roots of the brachial plexus. The 5 of them you can see, 5, 6, 7, 8 and T1, and they join to form the trunks and then the divisions. You don't see those have all been tied to this, and here is the axillary artery. So in this part you can see the cords, for example, and as I move this and move these cords to one side, I would like you to see if you can identify this nerve, and to give you a hint, I would say that it's coming from the posterior cord. Well, I would say that this is the thoracodorsal nerve because it is so long, and also I can see the axillary nerve going over there and the radial nerve coming down like that. These 4 nerves on my hand, or these 4 bundles of fibers that you are seeing, they are the ulnar, the medial root of the median, the lateral root of the median, and the musculocutaneous. And as we trace them down, you can see that the median nerves comes right in the middle. Here at the elbow, it's lying medial to the brachial artery. The ulnar nerve is going behind the medial epicondyle, where it can be felt and rolled, and when compressed there, it gives that funny sensation which results in calling this bone the funny bone or the humerus. And this here is the musculocutaneous nerve. Here on the posterior aspect of the arm, note the radial nerve as it lies in the spiral groove and comes to the lateral side. Also, for your own sake, identify these muscles, this one here, this, and these 3 of the rotator cuff muscles inserted onto the greater tubercle. You can also appreciate this nice space here, which is the spinoglenoid notch. So in the posterior forearm, this muscle here is the supinator. This is one little muscle that I haven't mentioned so far, and this is the anconeus. It helps the triceps in extending the elbow and is supplied by the radial nerve. Note the interosseous membrane, and these are some of the other extensors of the thumb and the abductor right here. In this view here, you can see that the brachial artery is dividing into its two branches, the radial and the ulnar. And here is the median nerve as it is coming down the forearm, and right in this distal part of the forearm, it's giving this one tiny branch that goes superficial to the flexor retinaculum. Can you name that branch? Yes, that is the palmar cutaneous branch of the median. You can also see the flexor retinaculum, which has been cut, and the nice deep carpal tunnel through which the median nerve is going to go to enter the palm. Here is the ulnar nerve coming from behind the medial epicondyle and down the forearm and up to this point. It is here, see, once again in the distal forearm, it's giving this little branch to go to the dorsum, the dorsal branch of the ulnar nerve. This, by the way, is the tendon of the flexor carpi ulnaris. Since all the nerves have been removed in this specimen, I'll use another hand to point out some of the branches. In this specimen, I want you to note the ulnar nerve and see how it is going superficial to the flexor retinaculum. Here I am putting the pointer behind the flexor retinaculum through the carpal tunnel, and you can perhaps see the tip coming through. It is this ulnar nerve here which is going to give these digital branches that you are seeing here, supplying this 1.5 fingers. And these other branches that you are seeing are branches from the median nerve which went through the carpal tunnel. That brings us to the end of this demonstration. But before you go, I would like you to test your knowledge by telling me or thinking how you would test for the distribution of the median and the ulnar nerves using just my hand. For the median nerve, if you were to touch in this little area over the thenar eminence and I could feel those sensations, then the sensory component would be fine. Would that be all? Well, you got to remember that there are two components that you want to test, sensory as well as motor. And for the motor component, you could ask me to oppose my thumb to the finger and then try to break this by pulling your finger through that. And that is because the median nerve branch supplies these muscles in the thenar eminence which enable you to do this. Similarly, for the ulnar nerve, you could check the sensory component by touching this little area over the hypothenar eminence, and for the motor component, you could hold the finger and then ask to flex the distal interphalangeal joint, because the flexor digitorum profundus is the only muscle that can flex that joint, and for this ring finger as well as for the little finger, it is supplied by the ulnar nerve. The last thing I want to say is that all the intrinsic muscles of the hand, whether they are supplied by ulnar or by median, the fibers they receive are from the T1 segment of the spinal cord.